Good afternoon. This wasn't planned, right? I'm Satish. I'm the CEO of Medi Assist. For some of you who know me, this is my 13th year at Medi Assist. And there was a time I used to be a tech guy, right? So I actually built software, I built tech. And now the team wanted me to do a demo. And clearly, I don't have tech to show. But we're going to spend maybe the next 20, 25 minutes telling you a story. Telling you a story of how some of the inspirational things that we've heard from Simon, from our panelists, from what we've learned from the Raksha Summit last year. We've been trying to take some of those pieces, trying to adapt and adopt some of the great ideas that we've heard, and try to sort of imagine a future which is slightly different from how it is today. So since I'm now the CEO, you will see more of slides and less of tech, but hopefully you will stay with us active in the next 15, 20 minutes and allow us to share how we are thinking about the future of healthcare delivery in the country. And of course, I think for those of you who've seen the knowledge report of Raksha Summit last year, it is, at the end of the day, if you want insurance for all, 2047, that's our target. There are two things that we need to solve as a country. The benefits have to be sustainable. You can't have insurers making losses. You can't have runaway costs and inflation. And the experience of the membership has to be super effortless, right? Without that, people are going to lose faith in how insurance actually works today, right? And historically and worldwide, these two are seen as objectives that are typically at conflict with each other, right? It's hard to focus a lot on member experience without sacrificing the sustainability and vice versa. So here is where we are as we speak today. Okay, that's good. So you heard some of the numbers that we spoke about are 85% today, and you will hear more and more and more of cashless in all of the conversation, because we believe that the member reimbursements are a crime. Nobody should be 100% out of pocket. Everybody should have universal access to cashless healthcare. So these are metrics that we very consistently track. About 85% of our cashless today is electronically submitted by the providers. Right? 70% of the value of claims that we process today are cashless. And by the way, 62% of admissions and 52% of the discharges today we process in under 30 minutes. Under 70% of that number gets done in under 10 minutes today, right? So that's the focus on cashless that we today stick to. Now we spoke about sustainability and we spoke about effortless, right? So where have we been on the effortless? Today, over 15% of all our monthly discharges that happen, people are walking out of the hospitals before the bills are generated. And we're not figuring out what the cost is. We're not figuring out how the policy terms and conditions apply. We're not making people wait. But people are actually walking out of the hospital the moment the doctor says you're good to go. And it's not limited to 5 hospitals, 10 hospitals. It's not limited to a couple of procedures. 30,000 hospitals today accept our estimates and letting over 35,000 patients walk out of the hospitals on a monthly basis. And we didn't lose sight of what we needed to do to make this sustainable. We saved over 400 crores on fraud, waste, and abuse in the last financial year, which was way higher than what it was previously and already running at a 50% higher run rate as we speak now in the current financial year. And the other metric that we take a lot of pride in is managing the cashless inflation across the Medi Assist portfolio, where we manage nearly 21%, excluding Paramount in that business. Our medical inflation for H1 was like 4%.
Against all the med inflation numbers I can see.
How did we do? Now let me just spend a moment on the effortless side of it. What did we do in the last 1 year? We launched 2 independent capabilities. One is called the Navigator, the other one is called Prime. And what are these? So Navigator today allows somebody who's planning a hospitalization to put it and get a reasonably detailed out-of-pocket estimation even before somebody checks into a hospital. And the out-of-pocket estimation, oops, okay, sorry, that's not tech, right? Okay, the out-of-pocket estimation. Today, 20% of our membership click on that link and figure out what their out-of-pocket expense estimates are. But what's more interesting is 40% of those who use the tool change their choice of a room type. If I had an eligibility where I could use a single room, not a shared room, and I would actually go back and change my actual choice when I get hospitalized, because then my out-of-pocket is within the limits of the policy. Right? Maybe we give them 30 seconds and switch to plan B. Just give me a moment. Right. So, all righty. And by the way, not all of the 40% is a downgrade. There is a finite percentage of those who also upgrade because they weren't sure earlier of their own policy benefits. And interestingly, after a year of running this Navigator, increasingly, the gap between what we predict and what is actual is significantly reducing. Now, how did we make this popular? We integrated this into the whole intimation process because the members have to intimate, right, upcoming hospitalizations. And this is what is helping customers make financially prudent choices. Now, that's about checking into a hospital. Now, how do you get out of a hospital? Today, we spoke about Raksha Prime. Now, the same capability to estimate, we share that estimate with the hospital and the members. And with the level of trust that we've been able to build because we underwrote the accuracy of that estimate. So far, over 400,000 members have been able to walk out of the hospitals before the bills got generated. And we continue to get a 4.7 consistent rating on 100% of these discharges that are facilitated through Raksha Prime. And it's been a very phenomenal journey in the last 1.5 years. Starting with less than 600, 700 discharges a month, we've actually grown. In fact, as the bar extends, we're currently at 35,000 discharges a month. And that's what Raksha Prime delivered. Now, what's next? In our belief, the next wave, because we're happy with the 15%, and of course, we're making 15% happy.
How do you make the 15% or 50% or 100%? Right? And that's really the focus as we speak. And for that, we believe we have to really put the providers in the driver's seat.
Remember, in the last 1 year, we never went back to a hospital and say, change your process. We've not gone back to an insurer and say, change your process and reimagine or adapt or do something. We actually just inserted a simple estimate into a regular process, got the patient out of the loop, and converted discharge into a simple B2B transaction between payer and the provider. And we told the patient, you can go home. You don't need to be sitting there and waiting for it to happen, right? You can actually go home. Now, how do we put providers in the driver's seat? Interestingly, while we always talk about cashless from a member perspective, cashless is delivered by the hospitals or the providers. Yet, by design, cashless today is a payer-led process, because no hospital wants to take a decision without actually going back to the payer at every transaction level. So even today, in the Indian industry, when the moment of truth comes, takes all of this documentation through and then say, dear payer, tell me how much will you pay, so that I can actually collect the balance from the patient and then let them go. But the only way to eliminate that friction and eliminate the dependency is somehow magically move the process from a payer-led process to a provider-led process, right? So that they can actually make those decisions on their own. So we now, for the next wave, we are bringing our counseling, which is the estimation, our checkout, which is Raksha Prime, and the insights that are required to do this with confidence, all of this into a provider-led, provider-managed platform. That's what we're going to do. And to make this obviously to happen, you have to enable provider to sort of safely own cashless outcomes without ever going back to an insurer in real time. And the next wave, hopefully when we finish executing this, we will actually get 1 in 2 members walking out of the hospitals without actually waiting for a bill to be generated. Now, how are we going to do this? This is how we're going to empower the providers, right? Which is the AI platform that the providers will have access to, so that the providers are able to click a button, get a push notification, and then I'd say, okay, let this patient go. And everything else is sort of taken care of by the platform. They get this predictability of insurance coverage, what is potential out of pocket on day 0, which is the day of admission, not as they get closer to the date of admission, discharge. And of course, we have to turn this into actionable insights so that the providers know how to manage the risk versus reward in the process. And the platform is built afresh on speed, first time right, and automation. So this is, let's say, the counseling, right? Historically, the counseling at the hospitals was somebody sitting behind a desk. You got a patient who's been asked to undergo surgery or a procedure. The patient goes there, sits, and then has a conversation. The people at the desk don't know what our benefits are. They don't understand policy. They don't understand limits. They don't understand exclusions. They're doing their best to guide you on how your insurance will work in that hospital, like for that procedure. Now, we've converted this into a very simple mobile app that the counselors at the hospital can actually use by clicking in a couple of things, and then actually get a fairly decent estimate of what the out-of-pocket will actually look like. And not just that, we're not just throwing a number. The out-of-pocket is not based on just tariffs. The out-of-pocket is based on the individual's eligibility and entitlements and the balances that are existing in their policy. And not just that, we also tell you, hey, by the way, you're going to lose 3,000 rupees on proportionate deduction. And if you actually go back and change your room type from a single room to a shared room, that potentially will go away, because then that's not the out-of-pocket that you actually have to pay when you make the right choice. Of course, keep going. So this is how the out-of-pocket expense estimate happens. And it's a very simple thing. The hospital's interface, no clutter, no conversations. You get a very simple flag and a push notification saying this particular patient is today eligible for Raksha Prime. Right? And you click a button, you just say, okay, I'm good with letting this patient go. Platform generates a letter, you let the patient go. It's as simple as that. Of course, today, we still process the discharge, but not making the patient wait. We still apply the policy terms and conditions. We still give insurer everything that they need. We still reconcile the insurer outcomes with the hospital, but all without the patient actually being in the loop, right? So the biggest thing that we're doing is to take the patient out of the loop and then improve their experience. So you get a simple prompt, you collect that, let the patient go. And so far, okay, let's look at a couple more scenarios. Yeah, let's go. All right, let's download the approval letter. Okay, keep going. And now that's as simple as that, right? And then of course, on the platform, it's not good enough if you just keep showing them notifications and ask them to let patients go without actually providing some kind of meaningful insights on what's happening. Of course, insights are not about the count of claims. It's not about, it's approved, it's rejected, but the real actionable insights, right? Insights for the billing desks, insights for the medical professionals, insights for the CXOs, insights for whether I'm billing right, do I have deviations, do I have my rejection rates? How am I comparing with my peers? Am I actually doing okay, not okay? Or am I doing okay with my peer basket? Am I not actually doing okay or not okay, right? Because it's our fundamental belief that a lot of the inefficiency that we see on the provider side is simply the lack of visibility of how things are running. I'll give you a very interesting example. When patients walk out, we expect the provider to send us a paperwork for a reimbursement, right? The network reimbursement. So last year, when we started looking at why the end-to-end reimbursement to the providers is taking so long, the biggest reason was them not submitting claims on time. Some providers were averaging 19 days, 25 days, 30 days just to submit the network reimbursement claim. So all we did was to put that number and present the trend back to their CXOs. And today, 92% of the network reimbursement claims are submitted to us within 7 days. All it needed was a simple push and a simple insight to the right people at the provider saying, hey, listen, can you just give your paperwork faster, right? And some of these is possibly what will change the provider behavior. We will be able to benchmark providers on their billing adherences, tariffs, deductions, and so on and so forth, right? So these are some of the analysis that hospitals have always wanted, and this is something that we're making available to every provider on the network, right? Keep going, please. And that's precisely the insights that we are talking about, right? All right, could we move to the next slide? So of course, this piece of software has been running in a closed beta with about 20 providers. We haven't yet opened that to the provider to operate. We have our teams operating that on behalf of the provider. It's fascinating to see that from a member perspective, the NPS that they collect from the NPS, it actually moved up by 50% in these 20 providers. Nearly 70% of all discharges are happening through the prime route where nobody is actually waiting for a bill to be generated in these hospitals. Today, we've reduced the discharge bottlenecks by half. We've improved the bed churn for the hospitals. The total escalations or the frustration that is exhibited by the members as recorded by complaints and follow-ups has seen almost a 30% drop in these providers that are actually able to use this insight or use the piece of software to actually let patients go and then take them out of the loop. Of course, it's nice to say that you put a software there, everybody will click a button, and everything will happen in real time. Of course, speed demands integrity, right? People have to be able to trust what they see. So far, we've built trust by putting our neck on the line. We said, hey, as Medi Assist, we're guaranteeing that this will be right. And that's how we got to a 35,000 walkouts, right, a month. And today, patients and providers trust because we are guaranteeing the integrity of the transaction, integrity of the estimate. Now imagine when we want to do this at an industry scale, not just a portion of Medi Assist. It has to be an evidence-based, like an integrity verification of the transaction, right? You need to know who you're paying, you need to know whether what you're paying is right, wrong, enough, not enough, and so on, right? And that's what we need to solve. Okay, now this is a lot of text, so please don't read, right? So this is where we went back and reimagined how we look at technology in this business. Historically, like we are good corporate citizens of the Indian health insurance industry, in all our life, we built tech to be a payer-led process, as built into our claims platform, into our matrix platform. We built, whether it is estimations, whether it is discharges, whether it is prime, everything was built into a payer-led process or a claims process. Now, this is where we're saying we need to reimagine this to be a provider-led process. So what we've done is to take all of these pieces that were historically on the payer-led process side, reimagine the stack, and then putting that back with the hospital so that they can actually do a self-serve. And in some ways, you're expecting the provider to take a leap of faith that the insurer will actually honor that estimate, right? And that leap of faith will happen when, one, you're not getting too many things wrong, and that you're able to say these rules and constraints are correctly applied, right? And of course, this is not enough just to give you an estimate, but you also need to make sure that there is no foul play at each transaction level, and that the contracts are being adhered, there is no fraud, waste, and abuse. And in our reimagined technology stack, okay, it's not my best work, but I will try and explain. In the past, we've had these distinct capabilities built on top of Matrix as a platform. We built Prime, we built Navigator, we built AI, because we fundamentally believed everything was about a claim. And we are moving that into what we believe, and this was the past. In the last few months, we've sort of changed our mindset a little bit, then went back and said, the provider pieces have to be surfaced independently on top of it. Now we are further reimagining that. We are saying that the payer and the provider-led pieces are two sides of the same coin, but they need to actually be built on the same stack, same AI capabilities, so that the entire contract enforcement is fully automated.
And of course, at the core of it is our ability to guarantee the integrity of every transaction. So we spoke at the beginning about the fraud, waste, and abuse efforts that we've been, building on, using our AI models. We now have a product that can be actually embedded into this ecosystem to guarantee the integrity of every transaction from a fraud, waste, and abuse perspective. And it doesn't matter whether it is processed like Medi Assist, it's somebody else's claim, it is an industry platform. And why did we have to do this? One, of course, like I said, people have to take a leap of faith. Second, the historical based models are hitting a ceiling. Okay. And most of the work in fraud, waste, and abuse in India has been a spray and play, right? You pick up a 30% of the sample, you investigate and hope to find a fraud. Or we say every claim of over value must be fraud because it's high value. So this is where, by relying on fragmented data systems, we've not been super effective in fighting fraud in the past, which means we are wasting our resources. We were making genuine customers uncertain because we were asking them questions even though they were real fraud. And the leakages were still high. In MAven Guard, we've taken a very different approach. Of course, we trained it using millions of claims. Just in the last year alone, we ran nearly 500,000 field verifications just to validate the outcomes
that our FWA engine has actually thrown out. And we used to run this like a batch process. We used to run like an insights. But today, MAven Guard, which is the new public avatar of the FWA stack, is able to look at every claim in real time and 100% of the claims as it processes through. In fact, it's not just when the claim is ready, when the paper comes in, when we scan, when we code, when we get more details, when we make the adjudication, when we get more insights, at every stage, Guard actually runs and sort of reassesses whether the fraud indicators are okay or not okay. And today we analyze hundreds of parameters across several categories of claims. We are able to uncover collusion, and we've got some very fascinating insights on like lookalike claims, including the values that are submitted in the bills and the labs. We're doing very interesting work on finding forged claims, the documents that are actually forged. We now know every entity in the country. It could be a mobile number, it could be an email ID, it could be a PAN number, it could be an agent, patient, hospital, the desk. Everything is an entity and every entity has a score. We actually know millions of these entities today in all of India on what is their fraud propensity and then what they actually contribute to fraud, right? And every claim that is submitted is actually going through this filter 4 to 5 times during the life cycle of a claim and allowing us to get sharper and sharper. Of course, we are still scratching the surface. We saved about 400 crores last year, potentially a 700 to 800 crores run rate in the current year, which is nearly double that number. And we're improving conversions, right? In the past, our sample conversion rates were so low that historically we went to a lot of genuine customers. Interestingly, the 2x to 3x more fraud, 4x to 7x hit rate increase came with us reducing the number of field investigations by 25 to 40%. We are actually doing far lesser work. We are going to lesser number of customers and asking them difficult questions. But yet, we are actually finding more because we are getting sharper and sharper by the day. And interestingly, you would know that Medi Assist is a very dominant player in the group business, employer-employee business. So please see this in the context of what we are able to do in historically understood as a clean business, which is the employer-employee business. And our outcomes in retail are even far superior, right, from what you're actually seeing today. Okay, so we now know, for example, by industry, by location, by claim type, by policy type, by distribution, by ailment, we actually know what happens in the country today. It could be an unrelated data point, but this year, in the first half of this year, we processed an absolutely lower number of infectious diseases compared to last year. The incidence of the infectious disease claims in our portfolio has actually dropped in absolute number despite the growth in the underlying portfolio. Of course, it has moved to something else, right? But so we actually know some of these extremely well. We're using to go back to our insurer partners and saying, listen, in the past, you asked me to investigate, say, everything about 150,000 or everything about 200,000, right? But the fraud distribution is not even, right? The fraud distribution is very different based on the value, the claim type. And happy to report that some of our insurer partners are coming back and saying, let's revisit the sampling strategy so that we can actually improve the outcomes. And our ability to find fraud now cuts across all kinds of misrepresentation, and not just any one specific type. It's now time for us to open up this FWA capability that we've, again, like good citizens, built inside Matrix, which is our claims platform. We've been able to actually extract this out as an independent capability. And MAven Guard is today available for any insurer with any claim system as an add-on. And we can actually put this on top of any legacy claim system in a 5 to 7 week time frame. And we've actually done this very interesting test on a non-matrix system, which of course we have access to. And in 60 days, we're able to get a 10 to 15x improvement in the hit rates from some of the legacy systems, right? So this is something that's available as of today. So we spoke about what we're going to do with the hospitals, how we're going to enable, and for the hospital to do that, we need to get them integrity. We need to make sure that the transactions are verified, the payers are comfortable. Of course, at the core of all of this, again, was something very embedded inside the Matrix platform in the past, in the claims platform. But we now realize that different insurers, different payers, different players are at different stages of evolution in the technologies thing. So we went back and looked at every single use case that occurs on the payer side or the provider side today. We said, we're not going to tell you how to run a claims process. However, I know that you need to scan documents. I know that you need to look for forgery. I know that your account managers need to generate a custom report, right? And we know that repricing, contract adherence, audits, and so on. So what we've done is to go inside Matrix, pull all of these capabilities out as single atomic capabilities, put them all into a stack, and we are now making that available to the whole industry. So you use whatever you feel like, whatever you think is useful for you as a payer, as a participant in the ecosystem. And it doesn't matter, right? So for example, we've got a standalone bot, which if you let us train on your policy, explain the claim level deductions and overlay that with your policy benefits, and actually explain that in English today, right? So that's what we are attempting to do. So this entire AI stack that has historically been buried deep under Matrix in our own claims platform, we are opening that up, and we are opening these capabilities to every single provider and payer that exists there. So that's the third thing that we're launching, right? From the provider, the fraud, waste, and abuse, and the AI capabilities. And of course, our platform continues to be available in all of these flavors today. Matrix is our platform. It's available to every insurer to process their claims. We don't need to touch it. We don't need to be the processing. We don't need to be the TPA for that business. We have a MAven Global, which is for the global IPMI business. We have MAven Guard, with all of our understanding and experience of FWA now available as a standalone AI capability that can sit on top of any claim system or any data source. The entire set of AI capabilities, we saw the whole laundry list as a stack on which you build your own applications. That's the MAven AI stack. And lastly, the hospital sort of becoming empowered to let patients walk without the fear of losing money and without actually having to wait until the payer actually gives you a confirmation. And that's MAgnum. That's actually will be available as early as Jan 26, once we finish the beta with some of these providers and payers. So that's basically what we are bringing to you this year. So this is our next step towards how to, instead of 1 in 6 patients walking out, how do we get 1 in 2 patients walking out of the hospitals? Instead of detecting 2.5–3% of the payouts as the fraud, what can we do to improve that number to a 4.5, like 5%? Because today it's our belief that there is at least an 8 to 10% leakage on account of fraud, waste, and abuse. So in a business, in a health insurance market, which is in the famous Indian numbering system, 1,20,000 crores, that still is a 10,000 crore number. And we are not saying everything is fraud. We are not saying everything is waste. We want all of us to be mindful that these are 3 different aspects. They are not one and the same. Historically, we looked at everything as fraud. So it's our absolute endeavor that we find every rupee of FWA that's sort of impacting the insurer portfolios. and return that back to the insurer. And that's our commitment. That's our understanding of how we actually want to come back to our original theme of sustainable benefits and effortless experience, right? So this is what we are launching today. Sorry, there were too many of them, so we couldn't do a online demo, but happy to have conversations, understand what we can do, because it's our fundamental belief that at scale, if you want to cover all of India, and with transactions growing much faster than premiums, while premiums are going up, all of us are concerned. You ask us, transactions are growing even way faster, okay? And some of you might find it surprising, especially as India moves away from plain vanilla inpatient-only catastrophic care cover, covering standalone outpatients, ambulatory care, primary care, and everything that all the friends said, in the previous plan. Rates are going out of the whack. As Medi Assist today, we process more outpatient claims. 55% of the claims that we processed last year were outpatient claims.
It's only 45% that is inpatient, and it is surprising considering that we don't have a lot of outpatient covers in the country today.
And we are not counting pre-post hospitalization covers. We are talking about pure play outpatient benefits, like pharmacy refills.
In labs, and so on. So clearly, incidence is going to be a runaway. We have corporates that we serve today where the inpatient incidence is maybe 10, 11%, right? 10 or 11 claims for 100 lives.
I have corporates where the outpatient incidence is 150%. I'm actually getting 150 claims for every 100 lives, and that transition happened just last 2 years or 3 years. I mean, for me, as somebody who's tasked with processing transactions, it's a killer.
So we have no choice as an industry but to find tech-led solutions if you really want to deal with this massive increase in incidence that is coming our way.
Because it's nice to say we'll expand benefits, but the benefits will translate to transactions. Your characteristics of fraud, waste, and abuse, characteristics of automation, characteristics of network, everything is undergoing a dramatic change. And with the regulatory push to improve experience, for example, cashless everywhere, today, 72 hours decide whether you will honor a cashless request from a hospital that you've never known. Because that's cashless everywhere. That's the intent, because the idea was that everybody will walk in and get cashless on demand. But look at what it is doing to our processes. In the past, we took 6 months to empanel a hospital. We did verifications. We did field audits. We checked if they had an operation theater. Did they have consultants? Did they have a... Done that. We've negotiated rates. We then took a very careful consideration on whether that hospital should be on our network. It is no longer the case. We get 72 hours.
And then suddenly your more fraud-based abuse characteristics in cashless are undergoing a dramatic change because it's not network, but behaving like network. So it's our call to the industry, and it's our commitment to the industries to build everything that we're building to manage our scale, which by the way is about 25% by premiums and nearly 50% by claims volume of the industry is managed by us today. Because our platform is used by insurers who also do in-house processing. So we're seeing 1 in 2 claims of the industry. We are seeing 1 in 4 rupees of the premiums of the industry.
So here is our commitment as we sign off today, that we will bring everything we know into a set of core capabilities that the entire industry can actually use. Of course, please pay us for the costs, but use the entire industry, and hopefully we will make benefits sustainable and the experiences effortless. Before we sign off, I would like to take a minute and get my entire team that sort of worked on this stack a moment just to show their faces. Right? Thank you so much for patiently listening to this story. Thank you. do the customary things, right? Thank you so much for giving us an opportunity to do something like this, right? And this is the core team that's behind a lot of these features. Just keep going. Yeah, that's as far as we'll go.